Three, two, one. And we're live. All right. So I've got a very, very special guest with me here today. This is long anticipated. We were actually supposed to do this last week, but he had an emergency come up and we had to reschedule for today. So thank you guys who tuned in last week. And thank you guys who are here today. We've got one person in the chat already. So we'll do point of order first, and then I'll introduce my esteemed guest today. So for those of you who do not know, I have a resume review program, or we have a resume review program. If you're interested in getting your resume reviewed, looking to go to the next level in the industry or just get in the industry, you want to email me at eliteclinicalgroup@gmail.com. Also have interview preparation. I'm meeting with a fine gentleman tomorrow. We're going to be helping him get his first CRC job. But of course, I've done, I don't know, maybe 100 of these at this point. So we also have that as well as career consultation. So email me eliteclinicalgroup@gmail.com if you're interested in any of those opportunities. So without further ado, I'm going to introduce a good buddy of mine. He's been in the industry a while. We actually started at the same organization a while ago. I'll let him share more if he feels like it on specifics of that. But without further ado, I'd like to introduce Eric. Now, Eric, you have your full name there. I don't know if you want that to be there, but or just your
I don't mind.
All right.
I have nothing to hide. I mean, do you think we're going to say anything incriminating today?
I don't think so.
Well, now I'm second guessing it.
Most people don't do it. You're one of a kind. So
really, well, maybe someone will see what I have to offer and pick me up. maybe I'll get free agency. I don't know. These deals, man. These NFL deals are looking good. I could suit up and go out, put on some pads, and go throw the ball for 20-30 million a year. I could do that.
I could do that too. No problem. I'll take the hits too. No problem.
I know, dude. Easy work.
So
yeah,
Eric, of course I know about your story and your background, and a lot of people have followed you before because you've been on the channel before a couple times at least. So for those that don't know, can you kind of detail kind of your career and your start in clinical research?
Yeah, well, first of all, thanks for having me on ECRG. It's always a pleasure and good to hear your voice. So yeah, I started off back in 2017 as a project specialist with a CRO, INC Research at the time, and had really no idea what I was getting into. Initially, I wanted to go to pharmacy school, and I was already interviewing and had some schools. I was kind of in the middle of choosing which one I wanted to go to, which direction, and I just had a change of heart because I was interning at a hospital in the indication or avenue, whatever you will, that I wanted to work in, and had this really deep conversation with this pharmacist who was just very generous with his information and wisdom, and pretty much just had a change of heart. And I mean, I had kind of been leading that way already, so I it kind of, that was the cherry on top of my decision. That was the last piece of straw that broke the camel's back. I don't know. I'm not really good at phrasing, but anyways, I had a change of heart and had some, different leads from people and friends and family. And I came across clinical research, and I had a family friend who worked in the legal side of it and was like, you might be really interested. A lot of people love this. A lot of people are PhDs and masters of science or ex-pharmacists, whatever you want. And I was like, okay, cool. So I checked it out, and pretty much the foot in the door was project specialist. So I didn't love the project management side like a lot of people do, but I wanted to get on the clinical side where I could apply more knowledge and just keep learning about different diseases and drugs and stuff. I always thought that was really fascinating since I was a kid. So I did project specialist role for a year and a half, and then moved into a CRA role. I was fortunate enough to get into the training program at the company at the time. And that was 3 months. And then I started doing my own travel after some sign-off visits, which are basically evaluation visits from someone, that's been in the industry for a while, like a clinical lead or something like that. They come out and just make sure you're good to go, and they evaluate you and do a report and critique you. And so I got out there and have been doing the CRA role for, barring COVID, I guess 3 years and some change. I guess almost 4 years.
Yeah.
Yeah.
Time has really gone by.
Yeah.
So now you're a senior CRA, right?
Yep.
Okay.
I am.
So how long did it take you to go from CRA 1 to CRA 2 to CRA 3 and senior and all that stuff?
So I was a CRA 1 for, I want to say, just about 2 years, just shy of 2 years, and I got promoted to CRA 2. And sorry, my cats are going crazy in the background. I don't know what's going on. Anyways, I was a CRA 2 for about like 2 months, and I realized like how much my company at the time had lowballed me. So, I knew I'd put in the hours, and unfortunately, retention with some companies have been kind of sluggish. They're not the greatest at it. So I looked at the fair market rate and talked to some friends and stuff, and I sent them a counter offer. And I'd already accepted. It was like a merit raise, so you can't really decline a merit raise. You can negotiate it, but sent them a counter offer and said, like, look, this is what I can get. I actually interviewed and got an offer letter from another company, like did my due diligence, so they weren't thinking I was just a joker.
Right.
So I sent it over, and they're like, we're so sorry, we can't do that right now. And this is kind of like when COVID was starting to pick up. So I kind of just like rode the wave for a little bit, and I was like, maybe I want to stay with here because I like the company a lot. And pretty much I just was interviewing with other companies while I was like, doing the minimal work, because I wasn't like a huge fan of the company anymore. And I was kind of like, testing the waters. And then COVID hit, and it went like and ramped up, and, sites were shutting down, or sites were only doing remote. And so our company was scrambling to find projects that they could assign people and like get things pivoted into remote. So I was pretty much okay, because I was like non-billable for like 6 months, and they just were just putting me on these like random projects. So I'd be like a little billable, maybe like 30% utilized. And I would just do these random like TMF reconciliation things, payment reconciliation things. And I just rode the wave. And then finally I was like, I'm going to get out of here. So I applied to that company that was kind of like keep me in their back pocket, left, and just rode that out. Didn't end up liking it that much. It was kind of like, grass is only green where you water it. And I thought it was going to be like amazing going to this new company, and I had some friends that talked it up, and ended up staying there for like 9 months. And then I went back to my original company, which is kind of funny, but it's kind of like a small lesson there. Like grass is really only green where you water it. Like, and that's where I ended up now. And I'm kind of working on something else, but I haven't achieved that yet. So,
okay.
Yeah.
So, I think you also talk to the point of, keeping your relationships good with places that you've worked and not kind of burning any bridges. What do you have to say about that?
Right. So, I mean, I did kind of say that I wasn't like, working my hardest, but I was still hitting my metrics back then, and doing everything they told me. I just wasn't trying to be a hero anymore, because I was kind of like, if you guys aren't going to pay me like what I deserve, I'm a little like burnt out here. I'm not going to like be breaking my back. So, but I will say
100%.
like, it's really good to, what was that?
I said 100%.
Yeah. Yeah. Like, cause they're obligated to you as much as you are to them, right? Like they need you to run the company, and you need them to pay you and keep you happy and take care of you. So if you don't feel that way, it's not mutualism, and you might have to cut the cord. So, yeah, I pretty much just think that it's really important to, keep good rapport. Even if you're leaving on bad terms, you got to realize there's like a human level to all this. And people understand that, if something in life happens to you, and you're not in a good place to continue doing your job, or, something, you're just not really enjoying your role, and you're just having a tough time adapting to it, or you just hate the project, you just got to let them know. They're not going to be able to read your mind. So you just got to keep an open mind about it, and just always assume people don't know what's going on. And so fill them in. They might be able to help like rectify the situation. and keep you happy. If not, I just think it's a good idea to clean up your loose ends before you leave. Like, don't leave a bunch of like issues and problems. And if you have documents that you're the only one that's collected, turn those in, like put those into the TMF or send them to someone. Be like, I'm not going to file these, but I want you to have them. Like, just make yourself look good and try to do as much as you can to your best ability before leaving, because I think this industry is starting to pick up more on it. Like, I think you used to kind of be able to get away with like murder. Like, you could just leave everything just completely in disarray and they wouldn't really like consider it. But now I think people are starting to hold people accountability, like within the company, and you can get blacklisted from a CRO or a sponsor, like client, if you leave on bad terms. So I just think it's always worth, like, even if you're in like a kind of like an altercation, not like a verbal altercation, or just like you have a bad relationship with someone, like suck it up, like say something nice, try to, ride it out unless it's like really egregious. And then, if you ever need to, you can come back. And I just think that's really important, especially as our industry kind of starts consolidating into more companies acquiring other companies and stuff like that.
No, you're 100% right. Especially with the consolidation, you might be working for that same person again, or they might be interviewing you for another job down the line, and they're going to remember how you left that study,
right?
Or how you left the company. They're going to remember that, and
yeah,
that may not turn out to be a good thing for you if you're trying to get that job from them.
Exactly.
Okay, so I appreciate that background. We got a question from Clinical Research Maven. I don't know if you can see it, but I'm about to prop it up here on the screen.
Yes.
Clinical Research Maven asks, is there an industry standard for each CRA level, and what's the difference for each level? Or what do you have to say on that, Eric?
Yeah, I would say there is. Like, for instance, your CRA 1, you're still kind of like in training, you're still learning the ropes, because however they simulate it, or, whatever workbooks or like training you do, it's not realistic for you to like be able to apply that right off the bat. And there's different scenarios that can't really be simulated, because, they can say like, oh, you might have a bad study coordinator who will not, close out action items, or isn't reporting deviations or adverse events and stuff like that. So they do little like workshops where you deal with, I have to step in and take initiative because this person isn't doing A, B, and C, whatever. So CRA 1, you're kind of still like an apprentice essentially. And then CRA 2, I believe, like, so you're going to start conducting more difficult visit types. So I think CRA 1, you're really just doing like IMVs, interim monitoring visits, which are just your routine monitoring visits between like the pre-study selection visit and then the site initiation visits,
right,
and the closeout visits. So that's your kind of, I think, like your bread and butter for when you're a CRA 1. And then if you move into CRA 2, they might add in like SIVs and closeout visits, COVs. And then like senior CRA, which I've noticed, you're doing all visit types. You're going to be working like a lot more independently, like the CTM or CTL, clinical team lead, clinical trial manager, whatever you will. They kind of vary between companies. They're going to kind of think of you as like their counterpart, and they might give you some of their little roles and responsibilities. Like you might have to run some reports or do some kind of metrics reporting, or some kind of deliverable sent to the sponsor or the team. You might have to like review some visit reports and just helping them out. And essentially, it's kind of like if you declare that you want to move up to the next level, which is either senior CRA 2 or clinical team lead, they'll give you those. But also, I have seen where they will delegate those tasks and responsibilities like without you asking. So I just think it becomes like more workload, more independency, and I think there definitely are.
So they have you reviewing other people's reports?
Yes.
Oh man, that must suck. How you like that?
I mean, it's not terrible. It's just some people just are really bad at it, and hopefully none of my
Bad at
colleagues are
what?
listening to this. Bad at just writing reports. They're just their grammar on paper isn't good, and they lack details. For instance, like just explaining like CRA had a discussion with the principal investigator regarding adverse event that occurred for X subject, and then they won't elaborate on what it is, like what happened. Is it resolved? Has it been reported properly? Is it documented in the
Right.
subject source? Has it been escalated to the medical monitor and the sponsor as needed? If it's like a adverse event of significant interest or something like that. And just like they'll say like something that constitutes the need for an action item. They won't put that. And I think a lot of it is like, maybe it's not they're bad at writing reports. Just when you're a CRA, there's a lot of moving parts and it's easy to get sidetracked with like a call from a site or an email or like another deadline. You're like working on a report and you're like, oh, something else, like I have to get over
Right.
here real quick. So I can see how easy it is to get sidetracked. So maybe it's more like that. But I volunteered to step up and do it. I've been asked in the past, and I've helped like during PTO as a backup for my clinical lead.
Yeah.
But I'm looking to move into a different role, so that's why I've been doing it a lot more regularly.
Okay. Let's
Yep.
talk about that. What's the next role look like for you?
It would be a clinical team lead. So,
Okay.
yep, it would be essentially dealing more so with like oversight of the team, managing deadlines, being a kind of like a middleman for the sponsor, attending team calls, ensuring like visit report turnaround and visit in general, their metrics are being met.
A lot of
Um,
calls.
a lot of calls, yeah, a lot of calls, a lot of emails. But I'm looking to get out of the travel role, so for personal reasons. So that's my next step, and that's my plan, and I'm working on it.
Okay. So when do you think that will happen?
I'm hoping in the next few months.
Okay.
So, yeah, in an ideal situation.
Is it going to be at the same company or looking elsewhere, different companies?
I plan on it being with the same company.
Okay.
Yeah.
Good deal. So because you have jumped around a good amount, let's provide some value to the audience here. Can we talk about interview advice? Any advice for interviews that you may have?
Yeah. I mean, can you say more specifically, or do you just think like I should say my like favorite little tidbits of advice that I tend to stick with, or?
Yeah, go with that. Your favorite tidbits of advice.
Yeah. So, I would always say like prepare yourself by knowing about the company and ask um, your recruiter or talent acquisition specialist, whatever they call them. They have like so many names now.
Right.
Just call them one thing. Can we just call like in this industry? Can we just call everyone one thing? Just like
Yeah, I
one
know.
different
That's
names.
that's one of the annoying things about this industry.
Yeah, all these damn acronyms. Yeah. So I would say like just start off by knowing the background of the company. Like you don't want to go in being like, yeah, I love medicine and healthcare. This is cool, like pharmaceuticals, and you don't even know like what their main pipeline of drugs is. If that's like this like a client, like a big biopharma company. If they're like neurology or like oncology based, you're gonna want to know that. Like maybe know a little background about where they start, and like just ask your recruiter, because a lot of people think the recruiter is there just to initiate you from point A to like your interview through the contract or um, salary negotiation, and then get you into your like new hire organization. It's not that. Like they're
Mhm.
there to give you like more information. They're trained up on the history of the company, the different departments they have, different positions. I would just like ask them as much as you can, like to give a detailed description if they can, because a lot of stuff's done on the fly and they might not have like a place for you yet. But if you could just pick their brains and be like, why is this company so great? And like, a lot of people in corporate America, they really buy in and drink the Kool-Aid on, the company they work for. Like it becomes like a second home for them. It's like their favorite sports team. Like a lot of people like really root for their companies because they want to be successful and have opportunities for growth and, you know, keep their job security. So
I mean,
I would say just like kind of learn as much as you can about the company, and first things first, and impress the, you know, people you're interviewing with, and just show that you care and you're not just like here to make some money. Because there are a lot of people that really, really are invested in it more than just, you know, in a source of income. So
yes.
let's say part one, start with that.
Okay. And so what kind of ways can you learn about the company? Obviously talking to the recruiter. That's actually one I haven't talked about on this channel before, but that's obviously, you know, that's a pretty good, and it's kind of obvious too, but most people I'm sure don't think to ask the recruiter a bunch of questions about the company.
Right. Yeah. I mean, my first interview too, I was so nervous. And it was just a phone call with the recruiter. I just wanted to like really try to sound like I had my, you know, ducks in a line and like sounded somewhat intelligent. And
Right.
yeah, I think you should treat that phone call like your screening interview. Obviously, you want to be professional and you know, appropriate and everything. But at the end, when they say, "Do you have any questions?" instead of saying, "No, I think you know, communicated everything I need. I appreciate it," you can say, "Yeah, I've actually looked into this and, you know, yada yada yada. Like, what about this?" And I'm not saying that kind of conversation is going to like impress the recruiter and be like, "Hey, this person's really good. You got to get them." You never know; it could happen. But it's more so for lining you up and setting you up for discussion topics when, you know, maybe an interviewer, you might have a bad interviewer and there might be some like awkward, quiet pauses, or, you know, at the end when they ask you if you have any questions, you can drop those questions on them, kind
Right.
of woo them a little bit, and just keep that conversation going. Because at the end of the day, people we work with are kind of like family in a sense, and you're around them so long, whether you like them or not. It's kind of like your second family. Like you're talking to them every day, working long hours, putting together projects together. So you kind of have to make people, you know, enjoy your presence. You know, kind of have to sell yourself. And sometimes in clinical research, like actually very, very commonly, the people who interview you are the people you're going to be working with. It might be your line manager, it might be like a project
Yep.
lead, project specialist. That's kind of like the new wave, I think, of hiring. So
Well, they've been doing that. It could be a colleague too. I know
right,
I've interviewed colleagues of mine that I work with now. I mean, we don't really hire that much, but yeah.
right,
So yeah, that's definitely a possibility.
yeah,
Um, okay, and then you know I've always talked about the Glass Doors of the world, the LinkedIn's of the world, to kind of get more information on the companies, and obviously their website is good too.
yeah.
But I think talking to the recruiter and really asking questions to the recruiter, that's a really good tidbit. Um, okay, so what other interview advice would you have? So I mean, you get some good information about the company. And
Yep.
obviously you can ask questions about that during the interview process. But what else? What else do you kind of do when you're preparing for an interview?
I tend to like write down a like almost like a script, like a dialogue. I pretend like, you know, I'll look up whether it's just general interview questions, which can kind of be like hit or miss, and also a lot of interview questions, you know, that you'll see online are kind of becoming like obsolete because they're realizing that doesn't help determine a good candidate. That just
Yep.
helps determine if someone can like BS an answer.
Yep.
So I tend to just like either ask, you know, family or friends from different, you know, avenues of industry, and just say like, hey, if you were interviewing, what kind of questions would they ask you? And just kind of build on those. So I'll write these questions, and then, you know, I'll kind of like outline it, put like you know, uh one response, then I'll put like a second response, and the third response, just kind of varying like maybe the direction they're coming at. And I'll just write those and I'll read them a few times. I'm not trying to memorize them. I'm just trying to like
Mm,
expand my thought for like a, you know, a left field question that they might hit me with.
yes.
So yeah, so I pretty much just do that. So and then I'll also kind of like look through maybe some kind of clinical research paper, or like a, you know, if I'm trying to work for something in like CNS or general med, I'll look up something like current that's ongoing, and I'll kind of look at terminology and just get myself refreshed. So because when you're interviewing and trying to like really prove yourself, you're kind of thinking at a different level than when you get stuck in a project and you're just like one dimensional. So I try to keep the terminology, up to par, and pretty much just like, I think I'm pretty natural at interviewing. I just tend to freestyle it, but I think it's good to just reacquaint yourself with the basics. ICH GCP. Do you know about like report turnarounds? Like look up job descriptions and like read through that and kind of get an idea of what they're going to be looking for. So when they hit you with those questions, you can say, yeah, I understand that the turnaround for this or that is 5 days. And, like you can just flow through the interview. I think that's like really my big thing, just getting prepped and ready to go for like any kind of like serious question they ask.
I love it. One of the good things also is if you look at Glassdoor, sometimes people will say what questions they were asked for that same type of interview.
Right.
So I'm a big proponent of looking at Glassdoor as well. Not only for the salary, you can see what the salary ranges are, but specifically you can look at the comments and see what people are saying about that position, which also allows you to ask similar type questions or ask about those during the interview at the end.
Right.
More so than just looking online. Everyone's going to ask those questions that are on the website. They're going to ask about that stuff. But if you can really look either by talking to somebody on LinkedIn or look at Glassdoor, what somebody's actually saying, you can ask a deeper level question, more thoughtful and deeper level question than just someone who didn't do that work.
Yeah, that's great.
Okay. All right, guys, I'm here with Eric. And we are answering your questions live. So please drop your questions down in the chat. We've got one question from Clinical Research Maven. That's it. So we've got another 30 minutes or so. We're going to be live here. So drop your questions. Now is the time. And this is probably the last live I'm doing for a little while too, by the way. So get your questions in now. All right, Eric. Here's my next question for you.
You see, I changed my name.
I see.
So maybe I said too much, and now they're gunning for me. There's some people out there, some agents. I just heard something outside of my house, and I'm thinking.
I don't think so. I think you've been pretty safe so far tonight. But now we can really ask the question we want to ask.
Right.
So, what do you like and dislike about working for a CRO?
I definitely like that they pay a lot.
Yes, they do.
They do pay a good premium. I like the abundance of positions. I feel like CROs have just so much going on that, you'll probably find a lot more variety of positions to choose from. I mean, I don't think I'm really going to go deviate from like my path right now, but if I wanted to, I can go like possibly get into like study startup, get into like one of the groups that runs the various meetings, like whether it's like bid defenses or investigator meetings or just like, planning, think shops, just to like, hey, how can we improve this study and how can we improve enrollment?
Right.
There's like pharmacovigilance. There's just so many avenues. I can't even think of all of them. So I think that's a really cool idea. If you're like not set on one thing, you can kind of like say, hey, I want to apply internally and go somewhere else. I'm not saying like biopharma and like big pharma companies don't have that, but I think CROs really have like a lot of diversity in their job opportunities. Yeah, you agree?
I do agree. Because most of the time, I guess when you're going to one of those bid defense meetings, you're meeting with the project management team of the pharma company. So it'd just be like the equivalent of a project manager at a CRO.
Right.
And those people will be there as well. So I definitely agree. But of course, the project management, I guess, if you hire a CRO to do the work, the project management for a sponsor looks kind of different. It's more like oversight rather than like doing the work.
Right. Right.
So it's interesting.
It is. Yeah. So that kind of ties into like what's not so great about working for a CRO, like you are very metric driven. Like that's really their number one source of revenue, is making sure you're getting those visits. Um, and then the I guess yeah, the oversight from the sponsor, and just it is more of a I think a business ended than more of a clinical ended feeling sometimes, because you're like, you're on site trying to do a good job of monitoring, and you're trying to make sure you catch everything, but then you're like, I gotta get out of here within the allotted hours for the budget so that we can remain profitable. And then I have to go to another site and you have to do like 2 visits a week. And I mean, it's super doable. I'm just saying, like, there can be some times where, they have like a database, like soft lock or hard lock or whatever you will, or like
Yep.
some kind of milestone they're trying to meet. And like, you feel pressured and you're like, they're like, we can only do one more visit. It can be 6 to 8 hours. And you're trying to do a good job. Like some things come up and you're like, hey, I'm going to need more time on site. And they're like, okay, we have to get approval from the sponsor. So it's kind of like, you feel like you're being like, your hands being held, and you're like being, kind of like helicopter parenting or
I
something
got
like
you.
that. Like they're really hovering over you.
Right.
But that's not always. Like I've had experiences on studies where the sponsor was like almost non-existent, and it really felt like I was just working with my company. Visits were super easy to schedule. So I mean, it's just really the cards you're dealt at the end.
Eric, I know I've been telling you this for a long time. I really wish you could go work for a sponsor. I really wish you could go do it, because all the stuff you just mentioned is not really an issue at a sponsor.
Right.
So hopefully you'll do that one day soon, because I think you'll be like, wow, I should have did this a long time ago.
I mean, maybe I'll wake up one day, man, and listen to you. I'm just stubborn. So. But I hear you, man. Maybe one day, like, down the road, once I get some more experience, I'll want to go down that avenue. But
yeah. I mean, I definitely think starting in a CRO is better, and then eventually going to a sponsor, because one of the things that can happen at a sponsor is not many people leave. So the opportunities to get promoted tend to be a little bit less.
Mm-hmm.
And the opportunities to move up tend to be a little bit less as well, or they take longer.
Right.
They definitely take way longer than a CRO, because CRO, there's constant turnover. So 100%. There's always opportunities to, level up in different ways. So that's what's good about the CRO, from my perspective, is you can get promoted a lot faster. And then you can go take that high promotion onto a sponsor and get paid top dollar.
Right. You're right.
So it's definitely nice. And, hopefully you do that, so you can kind of understand the difference. You can always go back.
Yeah.
But I don't think you will, though.
That's what I'm saying. Don't burn bridges. You never know. But
exactly.
Yeah, I mean, I think at one point I will work for a sponsor.
Yep.
I know they have like good golf tournaments and they give out good swag. So
oh yeah, they give out plenty.
I need that. I don't want Columbia fleeces. I want like a North Face or a Patagonia or something like that.
Yeah, I got one of those too. A North Face.
I bet you do, man.
I think I had it on. I think I had it on when I saw you in the when you were in first class and I was in coach the other week.
Ooh. Yeah, I mean, you definitely have some cool perks. Like, it seems like it's more of like a fun culture, because you guys are like, yeah, the CROs are taking care of everything. We're just making sure they're not fucking up too badly.
Yeah.
Excuse my French. And you just have Friday happy hours, and you get cool clothes and nice. You probably get Yeti water bottles.
That's super name brand.
I know, man. I'm just kidding.
All right. So you've given a lot of good game. Guys, drop your questions here below, because I don't know the next time Eric's going to be here. He didn't say he's not going to be here anytime soon, but I'm just saying he's a busy man. Man,
it was hard making this time for you, but you're my guy, so I had to.
I appreciate you, man. I appreciate you tremendously.
I know. I appreciate you too.
All right. So you talk about things you dislike at a CRO. What are some things you like working at a CRO?
I like that I know I'll always have a job, because Well, I mean, I know I'm a good employee, but I'm saying there's always new opportunities. They have like hundreds of projects ongoing, ones that are coming in, ones that are closing out. Whether it's like going into commercialization or it's just getting started in phase one, like there's always something in the pipeline in their portfolio, whatever. I like I said, pay is good. I like I like a lot of the camaraderie and stuff and the community it builds. I feel
Mhm.
like it's probably at any company, but I ended up coming back to this company just because I felt like I was missing that when I went to another, one of the big three CROs.
Yep.
And I just think, it's just really what you make of it. Like, I mean, any company, any job is work at the end of the day. Like, there are times where I like wake up and I'm like, man, do I really want to go travel today? Because travel is amazing, but it also becomes a chore at times. I'm gonna be honest with you. It's
Yep.
this industry is awesome. Being a CRA is incredible, but it still is a job. Travel after a while becomes a chore. You start to miss out on things at home. Coming home, you're like not really unpacking your suitcase. You're just burnt out, and you're like 2 days later, your suitcase is still in the same state it was from the previous week, and you have to unpack all that and then put new shit in
Oh
it.
yeah, man. My suitcase stays on my floor open.
That's what I'm saying. The cats are sleeping in it. Like, so, I mean, it's not really CRO ended. I guess it kind of goes and ties into like the metrics and stuff like that. But I really do think like, so for instance, you working at a sponsor, you said you have like kind of minimal travel. My travel,
By comparison, yeah.
right. So by comparison, like you don't really have like the metrics that I have. Like you
No.
said, you're out like once a week, maybe 1-2 days on site. I have to be out 2 days on site. I can split it up. I can do 3 one week, 3 the other week, and then 1 and 1. But like I tend to just keep it 2 and 2. And it's I kind of lost my train of thought, but I was just saying like it's hard, but it's also really rewarding to like see new places that you wouldn't, see, on your own terms. Like I've been to some really cool cities and towns and stuff.
Let's talk
Uh,
about that.
Traveled on a company's dime, and you get per diem and reimbursement for this and that. It's really cool. It's really cool, and I think like with a CRO, you get to do that more than you would with a sponsor. Maybe not. Maybe it's kind of equal, but from what I've heard through my friends that work at various sponsors, they travel less. I'm going like all over the place. If I want to, I can go to Hawaii, but I choose to stay on the East Coast. So that's my
Because
region.
that Hawaii travel is brutal. They're only going to give you 1 day of travel time for that, right?
I guess. I mean,
You probably need 2 days.
our CRA on the he's actually in the Midwest. He's in Texas. He said it was 13 hours each way. So I mean, it seemed like he had a day, and he was like really jet lagged. I was like, man, I hope you got to enjoy some views. And he was like, I mean, I did for like a couple hours, but I had reports and stuff to work on. So
Ugh.
I mean, he could have stayed longer, but he has a family and whatnot. So, as you get older and you have a family and stuff, it also becomes harder, like, but when you're fresh out of college or like maybe single or, like if you're significant others in college or something like that, grad school, I mean, it's incredible. Like that's what I did. Like
Yep.
my,
It is incredible.
girlfriend, fiance at the time was in PA school, and I mean, she like didn't feel bad that I was like on the road because she couldn't hang out. So all over the place, seeing new things, meeting new people. It was really cool.
Yeah, man. You're definitely right about the traveling to some places that you normally wouldn't go.
Right.
I've been to Jasper, Alabama. I will never go there again. It's like maybe an hour or 45 minutes side of Birmingham.
Yeah.
Incredibly racist. Okay.
Oh,
You go downtown and they got like a Confederate monument to like every like Confederate soldier ever alive in downtown Jasper, and it's just not the best place when it comes to that. I mean, but of course, I'm talking to a guy from
Yikes.
Richmond, so
I
which was the capital of the Confederacy. But they're
know,
getting
right?
better from what I've seen.
Well, I'm originally from the north, so yeah.
But
I
yeah,
mean, I was in Little Rock, Arkansas, which historically is like a very cool place, especially for civil rights, right? But
yeah,
one of the most boring fucking places I've ever been to.
dude, I
Are we
rock
allowed to
with Little
curse on
Rock.
this? We allowed to curse?
Yeah, of course.
Okay, it was fucking terrible. Food
You
was
didn't like Little
terrible.
Rock.
I didn't. I mean, it was cool. I walked around. There was like a cool bridge. There was like the state house was cool.
Did you go to the Bill Clinton Museum? Did you see that?
I don't like the Clintons.
Okay, yeah, but did you see it? Because it's like
I
huge.
I did see it, but I didn't go to it.
Okay.
I refused to. I couldn't believe when I got into the airport, it was the Clinton airport.
Well, I mean, he's from there.
I know exactly. I know. I mean, I'm not trying to get political. But they're just.
Please don't, because they'll flag my
they're too-
channel. If you get too political, let's stay away from the politics.
Yeah, what are we doing, man? What are we doing? Anyways, I got a poke bowl. Here we go. We'll distract from that conversation. I got a poke bowl in Little Rock, Arkansas, dude. I got so sick. I was like, in retrospect, I was like, why in the world did I get a raw fish Chipotle bowl in Little Rock, Arkansas, dude?
Of all
Like,
places.
there's no water or anything around. I guess there is water. There's a river, but I mean, like, dude, it was clearly not fresh and it was like not properly handled. And I was like, man, I should have gotten like barbecue or like a hamburger or something like that.
Exactly.
Someone cooked.
Exactly.
So moral of the story, if there's anything you learned from this episode tonight, people, whoever's on here, don't get sushi in Little Rock, Arkansas, or Jasper, Alabama, for that matter.
Please don't. Please don't. Jasper had no good restaurants.
Yeah.
Like, I got this Mexican restaurant because it was like the highest rated place in town, and there were no Mexicans in there. So, you know, it wasn't the best.
Well, food is made with love, man. If there's no love in that city, there's no good food.
Absolutely. Okay. So what are some of your other favorite cities you've been to?
Oh man, there was a time where, like, right before COVID started, I was going out west and I would be in Phoenix, Salt Lake City, which I know you're huge on Zion.
Yes, I am.
And then like LA, which I mean, LA is cool. It's really, you know, exuberant and like high class in some areas. And it's like, you know, it really humbles you.
Yes, it does.
Like, I was in a Beverly Hills Medical Tower, and I would go out and get food, and it'd be like, I would just feel uncomfortable because it was just like literally just like the Kardashians everywhere. I was like, this is crazy. I thought I was doing well in life. Damn. So I would say Salt Lake City
Beautiful.
is the best place I've ever been. That was incredible. The sunsets, the food, just the city is so different. It's like, you know, it's kind of like Denver. It's built into the mountains, and it's like,
Yes.
like Seattle, it's got hills and stuff, and just so much nature, like so many outdoor activities to do. And it was clean. You know, it was just a fun place, man. I liked it.
I like Salt Lake City a lot as well.
Yeah.
All right. Do you ever like stay extra days when you're going on these work trips or anything like that?
There are some times where like I'll fly in early the day before and maybe leave like a little later the next day because they allow it, you know, like as long as you're not being crazy about it. And then sometimes I'll, you know, if you get approval, I think I've had this happen at both companies that I worked at. If you like reach out to your line manager or something like that and be like, hey, for the record, I want to, you know, visit. I have a site visit in like New York City, and I have a friend or family member who lives up there, and I want to say hi to them. If you know, have somewhere to stay, they're not going to pay for a hotel. Like if you have your visit on a Friday, you'll get your day of hotel stay paid. But then for the weekend, you'll have to find your own place or pay for your own hotel. But usually they'll let you use the company flight back on that Sunday or Monday, as long as it's not interfering with your work. So you get your flight in, your flight out, and then you just have to have a place to stay. So you can crash with a friend or family member. And I mean, that's amazing. That's a huge perk. And I mean, if you're a CRA for a CRO, you're likely to line up in a city that you know someone in. So
for sure,
it's pretty cool.
Especially you, man. You seem like you got friends all over the place.
Yeah, I mean, luckily, I have a lot of friends that have been in like the big cities like Chicago and New York, Miami, and all that. So it's been really fun visiting them.
Oh yeah, you used to go to Miami a lot.
I was there like every other week. That was wild. It almost got to the point where I wasn't even like excited. I mean, it was cool. Obviously, it's Miami. Miami is like fun, but it was the site there was like high and rolling, so I was working. I
Yeah, it was a
wasn't
lot of
just
work.
chilling. But you will have some sites where they're slow enrollers, or they just have screen failures, which means they never made it to treatment past screening, or they were early terminations, which means like maybe for efficacy or like non-compliance, or like an adverse event that popped up and scared them, or whatever. Maybe they couldn't travel or get to the appointments. So those are real easy visits because you have less data to clean, less uh, accountability for the IP to conduct and all that. So you might be able to sneak out earlier and go explore. But some of those sites are high and rolling, especially if you want to keep on track and look good and make sure you're getting work done and getting praised for it. You're going to want to grind, and you're not going to always have that free time. So just being honest here, I'm not
I
trying to
love it.
deter people. You should definitely get into clinical research. It's awesome. But
Well,
it's
you talked about wanting to be a pharmacist and do the pharmacy school route. Have you ever thought about leaving clinical research recently?
um no, because the whole pharmacy thing, like the reason I kind of got off that boat is it just, well, first of all, job growth. If you look at projected job growth for pharmacy, like pharmacists, whether it's long-term care, hospitalists, like clinical, um, compounding, outpatient, like you're working in a hospital outpatient pharmacy, or like Walgreens, CVS, it's negative 200 by 2025. There's going
Wow.
to be a negative jobs. And
Wow.
that's mainly, I would say, fueled by automation, by mail order pharmacy. Like they
Oh yeah.
have these robots that fill prescriptions, and they can verify to like 99% accurate, which is like way better than human error. You know what I mean?
Yeah.
So
And they
that's
don't need
kind
a
of like the main.
401k match or vacation or anything.
What's that?
I said, and the robots don't need a vacation or a
Yeah,
401k match or
exactly,
anything
man.
like
So
that.
exactly, and there's workhorses. They can do like a ton of work that more than a human can do.
Right.
But it's sad because that's like an MBA running that operation. Because like if it was a pharmacist, like they used to have pharmacists as the CEOs, or some kind of VP or something like that, of like CVS and Walgreens. Now they're like MBAs, and they start thinking too business centric, and you take away that like personal connection. Like when you go into a pharmacy and you talk to a pharmacist, it's different than having to call on the phone. It's like
Yeah.
you have that personal connection, and you trust them more. You can, it's weird, and I don't like that. So I considered like other avenues, like compounding, or like working in the ICU, because people that do that, they love it. However, those jobs are really hard to get. People sit in them, like you said, like people sit in sponsor positions, they don't leave. So that scared me. And I have friends who graduated pharmacy school. A lot of friends that we were going to all go to pharmacy school together. They do not like it. Like they are not happy with their jobs.
Oh wow.
And a lot of them, I've told them to come over to clinical research, but they just don't understand. Like they're like, that sounds cool, but I don't understand like
Yeah.
what I would do. I'm like,
Yeah.
it's
Hmm.
hard. It's because it's not really like out there for people to know. Like medical science liaison, like they don't really understand what that is. Some
Oh
of the
man, that
job
sounds like a great job.
That's what I'm saying. Like, you know what I mean? Like
Yeah.
basically like the medical monitor. Like if you're an MD and you're not like huge on, you know, working in patient centric care, you could go and be a project specialist for a year, or be a CRA for a little bit, and you're going to take a pay cut, but then you get your experience, and then you jump into medical monitor. You're making $300,000, something like that. It's crazy.
I didn't know they made that much, but I'm not surprised because they are MDs. So
They make a lot, yeah, and then a lot of them can negotiate their contracts because at that level, You're allowed to negotiate. They sometimes have their own practices still. They work
Yep.
for other companies as consultants. Like, it's
Yep.
crazy.
Our medical monitor still practices
Exactly. Yeah.
just to keep up to date, She
Right.
still
Which is awesome.
practices. So I think it's dope. It's super dope. And the MSL role is super dope as well.
Yeah, it
Um,
is.
you can be an MD, and I think you can be a PharmD doing it too.
I think you could be a PA or NP as well.
Probably.
Yeah.
So it's super dope. But you definitely need some. They say you need some experience. So yeah, like you said, you got to jump in and maybe be a project specialist or whatever first for a little bit.
Right.
But then you can, once you get your experience, you can, it's the clinical research is your oyster. You can go on and do what you want to do.
Right.
So
Exactly.
I love it. So now you're not thinking about leaving clinical research. You think about moving up in it.
Yeah. I mean, I've thought of a few different things, but I feel like it's a great place to be. Like, people always say, oh, like drugs aren't going anywhere and different therapies and stuff like that. They're just becoming more like plentiful. So I figure like, while I can, why not stay in this industry, get more experience and make money? Because I do want to open my own business eventually. I don't really know what that's going to be, but I would like to work for myself. I feel like everyone does. Like, after a while, you're like, yeah, it would be cool just to be able to make up my own schedule and do my own thing and all that.
Yeah.
But you have the opportunity to make like what people that run their own businesses make in clinical research. Like, you can make a killing,
Yes,
and
you
you don't have
can.
to worry about all the overhead and stuff. So I mean, it's a great place to be. But like both of us, you and I are both always like have that entrepreneurial spirit, and we're always trying to look for the next best thing. I think you're a little more invested in it than I am, but I have the thoughts at least. So I'm one step in the right direction.
I love it. Have you thought about becoming a contract CRA before?
I have some of the contract CRAs I've met like kind of left a bad taste in my mouth because they just kind of do like the minimal and then they like leave when they are getting pressure on them.
Yeah,
And I don't know if that's like because they are working for multiple companies at once
probably.
and just trying to cash out as much as they can. You know what I mean?
Oh yeah,
But it's super cool to do so. I mean, I know it's a great opportunity. You have like small contracts with a lot of money, and
we talking
you're not
85 to
investing in the
$100 an
company.
hour,
Yeah, dude, it's
and that's
doubles,
door to
like
door.
double. Yeah,
That's door to door as well.
right. Looks like you got some questions.
I do. Let's see what clinical research Maven has for us. She said, "Would you partner PA go into clinical research?" Do you know what she means by that?
Oh, my partner, like my wife.
Oh, would your part?
If
Oh, I see.
she said she would only do it if we opened our own site. She said she wouldn't want to go work for my company because she doesn't like corporate stuff.
Okay.
And yeah, and she's very extroverted, but she likes kind of, if you're in a hospital, you're kind of working on your own little project until like you got to collaborate. So she was like, I definitely wouldn't want to be like told what to do by a manager or something like that. So that's just her personality.
Interesting.
Yeah.
Yeah, I think PAs can be PIs as well.
I know NPs can now in certain states. PIs maybe. I mean, PAs maybe, but I know NPs are getting a lot of independent seat lately. Like New York just signed some kind of bill that allows NPs to open their own exclusive practice without any oversight, like from a physician, which is really cool for those APPs. I think that's amazing because I know some APPs that are super passionate about what they do and like they're very progressive in medicine, and I think they're excellent. Like, I would probably like to see them over an MD sometime because like they're just so passionate, and I feel like they do a lot of research for you and a lot of homework and come to you with answers. So,
Yep.
yep.
Okay. Clinical research Maven also asked, how about consulting work? So we kind of did touch on consulting CRA. Have you done or know about any other types of consulting you can do on the side?
So I've actually done some consulting through this company called GuidePoint,
Okay.
and they do it for like, you can be an engineer, you can be CRA, you can be like whatever, IT guy and gal, and they basically like ask you what your set rate is. And I've always put like crazy high amounts and they've accepted it. So, and it's usually like 30 minutes to an hour, but getting selected for those specific topics are very difficult. And like the screening questionnaires are really a lot. And it's like almost like you're giving them a lot of answers and like substance before you're getting paid for it. So it's, I don't know, it's kind of weird. But as far as like being a full-time consultant, I've never done that. I don't really know if CRAs are really in high demand for that, but I know as you get higher up in the company, like directors and like stuff like that, you can seriously be a consultant and like make crazy money doing it.
Yeah.
You know,
I do consulting with my resume review and interview prep and all that good stuff.
right.
So that's something that I've kind of like carved out for myself. I don't really I haven't done too much. I've never been a contract CRA. I definitely would be open to hear more about that, but
Yeah.
that's pretty much what I do. And if the demand was high enough, I definitely would have other people, do some of the resume review work as well. Cause I think hearing different perspectives would be pretty cool. And, interview prepping and stuff. I just kind of give them an outline of how to do it. And then they can, make it their own.
Right. Right.
So that'd be super dope.
Yeah, that is cool because that you're right. Like what you're doing is a different avenue of consulting, but it is consulting. It's not like the typical consulting you think of. Like these guys and gals are. I always want to specify for clinical research maven. Women are powerful too. All right, so I just think it's really cool that they'll literally help these small CROs or like small firms get started. They'll like give them advice and see how they're running, like see how their budgets are doing. I think that's really cool that if you get high enough, you can do that. But I feel like it's going to get eventually like kind of saturated.
Maybe.
As more companies get absorbed. And I mean, hopefully not, because I'd love to get involved in that.
Well, there's always a new biotech with a new drug to try, or a new small company with something new to try. And they're always going to need that consulting, because all it takes is one drug for you to become, a huge, like a multi-million-dollar or $1 billion company in pharma.
Some MIT kid that doesn't want to go public, they have a tiny little firm with a one molecule, and we help them.
That's all it takes is one molecule.
Yeah.
I don't know if I've told this story before, but I'm gonna keep it somewhat vague. But the person who started my company bought the molecule that started it all for $25,000 from Pfizer. So
wow,
it's proof that you can start a multi-billion-dollar company with one molecule, and that means that Pfizer had looked at it, analyzed it, and said, we don't know what to do with it, or we can't do anything with this. And so she bought it, and she made something out of it.
$25,000.
$25,000.
Wow, what a bargain!
I know, right? Turn that into many billions of dollars. So
that's so funny too, because it just shows you, like, I'm gonna draw like a comparison, like the NFL draft. How many quarterbacks, receivers, running backs have come out of the 4th, 5th round that have been like first round talent because scouting practices are terrible and they just overlook and they don't know how to evaluate. So that's kind of like what Pfizer did there. They saw this drug. They're like, no value in it. So then, your CEO bought it up, saw value in it, saw a need for it, whether it's personal or what, and turned it into a huge thing. And they probably are like kicking themselves. They're kicking themselves like,
yeah,
kidding me? We should have seen this.
Exactly. Because that would have been multiple billions. I mean, not that they need any more billions, but
right.
That would have been more billions on their bottom line.
Right. Yep.
Okay. So we've been cooking here for an hour. We got 7 people in here. Does anyone have any more questions before we call it a night? Because Eric is, I want to be very, very conscientious of his time tonight. He's been gracious to spend it with us tonight. So if anyone has any more questions, go ahead and drop them now and we'll answer them. I got one more for you, Eric.
Shoot.
And this is kind of something that you alluded to a couple minutes ago with the job market. Do you feel good about the job market for clinical researchers going in the future? And do you, if you were to get fired today, would you be worried about getting another job?
Okay, so first part, I think there's a ton of growth in the future for clinical research. I mean, there's been some talk since COVID, and a lot of like monitoring plans have switched to remote. But now that things are opening up, the world's opening up, masks are going away, and all that. We're getting back to full on-site monitoring. There are some sites that I'm sure are a little weirded out still that are doing remote, but they have talked about, at least in my industry, like my side of it, what can we do to make our monitoring a little bit more remote? Like, what are some activities we can do remotely, while what are the ones that have to be in person? So I can see, I don't know if it'll stick. I don't know if it'll be great, because remote monitoring at this time currently takes a lot more documentation,
Mm-hmm.
a lot more preparation, a lot more approval. So maybe if they can like streamline it and get it like a little more simplified, it'd work out. But they are talking about like you can be on site to do like equipment and facility review, IP accountability, like review of the ISF. But is there a way we can make it partially remote for SDV, which is source data verification, or source document review, SDR? I personally think it's going to get shot down, because like most of the PIs and study coordinators and stuff, they do not like remote, except when they had to for COVID. They understood that.
Yeah.
But I don't really see that reducing the potential growth or job opportunities. It might pivot. Some positions maybe dwindle, like CMAs and CRAs might become more like synonymous to each other. Maybe a position will become one.
Yep.
I don't know. So that actually could affect it. But and then what was your second part of the question? I'm sorry.
If you were to get fired today, would you feel any hesitancy or anxious about finding another job?
I really don't think so, because it may not be like the ideal company I want to work for right away. I might have to take some time, but like there are some companies, I bet you know the name, 4 letters. They are like sharks. They're like sharks, and they're like, I'll like have to email them and say, hey, can you leave me alone? Like, can you stop sending me emails? Can you stop LinkedIn messaging me like every day? And they're always like, would this sign-on bonus entice you? And they're like coming back with double, triple of that, like in the future when they keep bugging me. So like, I know there are jobs out there. They just want like people that have been CRAs, like essentially warm bodies at this point.
Yeah.
So I would have no worry one bit. Like I'd be 100% confident I can get another job.
Pretty quickly at that.
Yeah, 100%.
Yeah, I agree with that. I agree with that 100%. I wouldn't feel anxious about getting another job at all. And even with I guess everything kind of slowed down. Hiring slowed down a little bit in the pandemic. And actually, the people that were doing contract CRA work, they tend to get fired first. So that's one of the downsides about being a contract CRA is, you're going to be first on the chopping block if something were to go down.
Yeah, unless you're like really doing good work. I mean, even at that, they're going to want to get their people that are like, invested in the company to get back, and the ones that are committed. Yeah. Why would you care about someone that's a 6-month employee when you have someone that wants to be with you full time and like invested,
Right. All right, guys. Do we have any last questions before we let Eric go for tonight? Just point of order. Probably won't have a live stream next week. We'll probably go back to regularly scheduled videos for the next few weeks or so, unless something else comes up. I did get an interesting interview request from another CEO of I forgot, but we may do that interview at some point, but things are just really busy right now. So we're going to go back to regularly scheduled videos for the next few weeks, probably. And I know some people can't even make it to these live streams, so they probably prefer that anyway. Yeah, so I don't see any more questions. Eric, thank you so much for coming on tonight. I really appreciate it. You've been a true supporter of the channel because I think this is your third time being on. The first two times we did pre-recorded, and I've been really exploring with this live option so we can get some more audience feedback.
Right.
And it's been an absolute blast, man. I thank you so much for coming on.
Yeah, you're welcome. Thanks for having me. And I, wish you only success. And I hope this becomes a big thing. And just love to be a part of it.
We already a big thing, man.
Bigger thing. You didn't hear me. It cut out. I said big.
All right, we can go ahead and end it there. Thank you guys for joining tonight.